Mr. Jones, welcome to Sydney.
Thank you.
You had a lot of experience with Australia over the last sort of decades. What was your most memorable food allergy story from Australia?
Oh, geez. Most memorable food allergy story from Australia. There's so many. It's hard to pick from. Um, Maybe the first because that was so unique. It was somebody that was coming over from Australia to the United States, and I often thought of what would motivate someone to go all that distance. And it's more than the food, it was more that motivation. And that was the first experience that I ever had with that intense desperation that a food allergy mom feels for that fear of the allergen, and also the fear of what might happen to their child. And that feeling and that sense of desperation to think what would motivate someone to do that, to go to those lengths, it will always be, you know, engraven in my heart to for that. So I'll never forget that.
That's a great story. I mean, with hundreds and hundreds of family that you have worked with virtually and in person in Utah, is there a common thread that defines Australian food allergy parents?
One thing that I see is from Australia is most of the parents are just so, not to their fault, but just anxious. I sense in Australia a lot of fear-based messaging from allergists, from the community, and they hear that messaging so much that it almost gets taken out of proportion. But also, not that we're downplaying this, not that we're downplaying the severity of the allergy. It's just there's a difference of being prepared so you're not scared versus having that fear, and now you're being manipulated by or controlled, by a bigger entity.
The narratives.
The narratives, yeah, the narratives. And with that, the other thing that I see often is broad test panels have been done in these children. And part of what drives the fear too is most of the families I see are having to avoid upwards of 5, 10, 15 foods. And we've done so many food challenges with these parents, with the children, and a vast majority of these foods they didn't have to avoid. We got those back in the diet just by proper diagnostics. Well, it makes a difference if you're having to avoid 10 foods versus 2 foods. That's a massive difference and an impact to somebody. And one of the things that I see often, especially in Australia, is panels of food testing being done, many foods being avoided, a majority unnecessarily, but in the time that they have to wait to get a food challenge, I've also seen many people develop the allergy while they were waiting.
Which is terrible.
Terrible, right? And to a degree, from the parents' side, I can understand their fear, though. I can understand the anxiety. I can feel it. I can see it. But I think there's got to be some change there to give them better education, to empower, and to give them the tools for better diagnostics and better preparation. So again, they feel that empowerment and a choice to be proactive in their care.
One of the arguments in Australia about food challenges is they have to be done in hospitals. Now, in America, it's quite the opposite. There are many clinics for food challenges. So what is that point about infrastructure lacking in Australia for food challenges? How would you respond to that?
Where's the evidence? Where's the actual evidence to show a food challenge has to be done in a hospital? There is not evidence to support that. So part of that infrastructure is forcing people to do that in a hospital. I think it may be this is my opinion, but maybe a lack of training and experience with the allergists so that they are comfortable doing them in their clinics in an outpatient setting. I've done thousands upon thousands of food challenges over the last 15 years, never once in hospital. every single food challenge for the thousands that we've done has been in my clinic. And because of that, because of the setting, we now, by definition, are able to do them more efficiently, service the patient more, and get that more, help the patient so that they can get those foods back in their diet that are in question. And I think the part with food challenges that's so important is the first step to any kind of treatment is just an accurate diagnosis. You got to make that diagnosis first. Getting foods that they're actually not allergic to back in the diet is treatment step one. And when you don't have a system that can accommodate that, especially when you're making people wait, you're actually creating, putting at risk for foods. And I think it's interesting when they're looking at different products for perhaps just peanut specific. And I think, okay, but most people have other food allergies. If you're focusing solely on a peanut treatment, but you can't even get diagnostics or that situation right, and you're not putting a system in place that empowers that, perhaps we should start there.
You mentioned something about education, and you educate your colleagues a lot in the US. Can you tell us about your NGO in the US and how did you start this, not just awareness training, professional training for your colleagues?
Yes, so many years ago, a couple of other allergist colleagues of mine who had started food allergy treatment, we could see a day when this would become a standard of care, when it would become the standard. But we feared that the education level, when it was becoming the standard, we feared that perhaps we wanted to establish a certain kind of minimum safety standard for other allergists and other doctors as they were trying to go out and do the treatment. So we weren't getting that education from our academies, from our societies. It didn't exist. And so we took it upon ourselves to create an NGO or a nonprofit. It's called the Food Allergy Support Team. And our sole purpose is to educate and empower other doctors, allergists, to understand the science and the processes of food allergy diagnostics and treatment, and take that one step further in implementing that into their clinical practice seamlessly so that they can feel like they have a safe and efficient method by which now they can deliver diagnostics and treatment to their patients. And again, we wanted to kind of establish a situation where we were collaborating with each other and trying to establish the best practices amongst allergists. And by that, we've been able to have some extension out into the communities to those allergists that are wanting to deliver the treatment properly.
Has your organization been approached by any other international organizations or national organizations from other countries?
No, we have not.
Yet. Are you open to possibly collaborating internationally?
Yeah,
I
would be.
That's a great
Yeah,
step.
Yes, in fact, that really is what defines our NGO is collaboration. And those allergists that attend will often say that's the strength of the conference, is they've never been to a place where we were freely sharing information with each other. We are not funded by pharmaceutical or industry, so there are no other agendas. The agenda is our patients. That is it. And we are motivated by our patients to do the best for our patients. And so there's a free sharing, there's evidence and data that's presented, and I may be biased, but I still think it's one of the best food allergy conferences for allergists in existence.
So are we safe to say that international allergists who are interested could approach the food allergy support team in the US and ask perhaps to attend the conference in an observer capacity?
Absolutely, they can. It's open. Get on our website and register.
Brilliant. I think that's a brilliant message. When is the next conference?
June 21st and 22nd.
And the city?
Dallas, Texas.
Brilliant. So whoever is listening, you're welcome to contact Food Allergy Support Team. And
the website is fastoit.org. So fastoit.org is the website. And again, this is based for allergists, their teams. So it's also nurses can attend. So it's allergists and their teams. This isn't for the lay public. This is a more sophisticated scientific conference. But go to the website, and that way they can register for it.
Brilliant. In terms of your new role in Australia in this field, you are president of an Allergy Microbiome Foundation Limited. What are some of the possible goals that you see for Australia in the next 3 to 5 years in this NGO food allergy space, broadly speaking?
We want to raise funds so that we can bring up-to-date technology and diagnostics to Australia. Like I said before, the first step to any kind of treatment, whether it's food or otherwise, is correct diagnostics. And we're very interested in the biotechnology field and looking how we can bring more sophisticated testing systems to Australia for better diagnostics so that we can get these children accurately diagnosed, avoiding what they truly need to avoid, but get back into their diet what they're not necessarily needing to avoid.
When it comes to prevention, and this is one of your passions as an allergist, what would you say to parents of newborn children? What is the best way of preventing food allergies?
Yeah, one of the best ways, and this is well established now, there was a massive study that went out in 2015. It's called the LEAP study, and it talks about early introduction of foods to children. And many parents are scared to feed their children. Why are they scared? Because the medical community made them scared. That was the narrative for a very long time, is don't feed, don't feed, don't feed. And we were wrong. And that was overwhelmingly shown in studies leading up to 2015, which blows me away. It's 9 years ago now. But the overwhelming evidence showed early introduction of foods, diversification of the microbiome by far is one of the better ways to prevent food allergies. So I would say feed your children. Obviously, there's some that are at risk. Talk to your doctor. Get that appointment early, and talk to them and see if your child's at one of those risks. But otherwise, feed them.
With your Australian patients in the US, you observed an interesting trend that Australians tend to suffer a lot from dust mite allergies in particular and other environmental allergies. What would you say to those parents?
Don't ignore those, because the environmental allergies, dust mites in particular, or in the US even certain tree pollens, that can cross-react with some foods, and sometimes that confounds what we're trying to do with food allergy treatment. Food allergy it's not something that happens in isolation. It's in the midst of a person, in the context of a person, and that person is in the context of an environment. And there's interactions, bidirectional interactions that are occurring all over with a person and their environment, and also within the person. And so it's important to recognize that and understand that these things aren't in isolation. And the better control that we have of some of the other triggers that are out there, the more success we're going to have in trying to treat the food allergies.
In America, SLIT has emerged, the sublingual immunotherapy, as one of the newest kids on the block in a way, even though it's not new, for food allergies in particular.
Yeah.
What's your opinion on that?
Yes, that's a nice treatment option for patients. There's pros and cons to SLIT and OIT, or oral immunotherapy for foods. I don't see it often as one versus the other. It can be one, it can be the other, but we can also use a hybrid model where we're mixing both, and whatever's best for the patient. Perhaps the pros and cons of that might be another episode. Is something that we could talk about, because that's a big discussion. But yeah, it's a nice treatment option. It's something that can be offered. We just have to, what I want to do is just help patients understand the risks, the benefits, the pros and cons of each option, and have a choice. They want to have a choice. And the problem is so many patients and parents don't even have a choice nowadays.
Well, especially in Australia, choices
Right.
are quite limited. Oral immunotherapy has emerged as the newest line as an approach to food adverse reactions. But in the US, you mentioned you have been practicing it for over a decade. What is your success rate and why is it so high? Many are asking.
Sure. So our success rate is 92%. That's well over 3,000 patients. It's a conservative number. But we have I think, a higher success rate because we take an individualized approach to patients, integrated and individualized, where I focus more on taking a protocol and then adapting it to an individual and their needs and what that person is, versus trying to take every unique person and fit them into a standard one-size-fits-all protocol. Even on the gut health and prebiotics and probiotics, it's not a set one strain dose of probiotics. It's something that we can customize and individualize based off the person's microbiome mapping, based on their needs and what they're telling us they need. When I say they, I mean what their body's telling us, how their body's communicating with us.
Is this why the patient history, you say, is the most important?
Yes, patient history is absolutely most important. So many times people are looking for test, when really what they need is an in-depth conversation with that allergist with experience, and then we guide and base our tests on that conversation. But when you combine the history with the test results, we can really now gain insight into the person and their needs and adapt what we're doing. Of course, there's some non-negotiables, but we can adapt what we're doing to that person's needs. And I found you just have far more success that way versus, again, taking all these unique people with all these unique needs and trying to pin them into one standard protocol with one standard probiotic, one standard, set of rules to go by.
Why do you think Palforzia pretty much failed in the US?
Palforzia is expensive. There's a lot of kind of hoops to jump through in order to get it. And by and large, our food allergy support team did a survey of 129 practices in the US, comprising over 26,000 patients. Again, this is a conservative number, but those are big numbers. And less than 5% used Palforzia. So, and people are still having mass success. So what we've really shown is you don't need a massively big, expensive pharmaceutical product for food. What you need is education, knowledge, and quality food applied correctly to a patient. And that can get down to the DNA level and make the changes that are necessary to reconfigure the immune system so that it takes it from a potentially life-threatening situation. We can change that threshold to where that patient is now either safe from cross-contamination or they can get that food back in their diet. But we've shown overwhelmingly that can be done with commercial foods and appropriate application of those foods. Don't try this at home, kids, but appropriate application of those foods works just fine. Again, in over 26,000 patients, 95% of the time, commercial foods are used successfully.
Your point about changing the DNA is quite interesting for food allergy families, but also for your colleagues. It would be great to hear how a process like oral immunotherapy can change DNA so that the allergy is not transmitted to future generations. Now, that is something which is not really heard about.
The immune effects of oral immunotherapy get down to a cellular level, and it affects the cellular communication. I call them like chemical text messages, basically, between cells within our body. And so it gets down to that cellular level where how things are being communicated, that whole allergic process, it can reverse that and alter that at that level. And that's why it's so effective. And actually it will treat that root cause.
Wow. What happens 10 years after a person graduates from your method in oral immunotherapy?
Most of the patients are doing great. They're doing well. They're living life. They don't have that burden and the anxiety. What I see is normalcy, relaxation, just people thriving and living their lives. I mean, I've had people come in who were avoiding so many foods, nutritionally deficient, failure to thrive, anxious, almost paralyzed socially, in isolation. You want to talk about a pandemic and social distancing. Food allergy people social distance. They isolate and they have that fear and the anxiety. I see people 10 years after being treated, living lives of normalcy, being not isolated, but integrated and thriving, pursuing dreams, and not nutritionally deficient, that's for sure.
Dr. Jones, thank you for making your patients' dreams come true.
That's right. Yeah, no problem. It's what fuels the fire.
Thank you. We'll see you again in Australia soon.
Thank you.
For a masterclass. So Dr. Jones will have a masterclass in July. Details to be confirmed. But whoever is interested will guide you in the future. Thank you.